Mostly, I can say one of the best country. If I compare with UK, especially after PLAB.
Yes, sir. All the question banks from academically, all the grant tests, everything. I mean, there are enough and more questions that which is more than enough for us to pass this exam.
Students are mixing the material from this coaching to this that coaching, or sometimes self preparation. Hello everyone, welcome to you all once again. Today we have a Dr. Shiva with us. He just passed Australian Medical Council exam and he's an Indian doctor, and he completely studied from Karnataka, and he's working last 3 years and just give this exam and pass the exam. Let's see his journey ke how many hours he studied, and what are the books, resources, each and everything. So Dr. Shiva, first of all, congratulations to you. You passed this AMC exam.
Thank you, sir. Thank you so much.
Okay. So, Dr. Shiva, if you can just give us, you passed this exam already, so how you can rate this
Yes.
exam? Very, very, very tough exam or mediocre exam if we compare with, other exam like NEET PG in India.
So first of all, the main difference between the entrance exam in India, like NEET PG and the AMC, is like this is completely clinical oriented.
Yes.
So there is nothing specific you can learn or something. They always test your skills in clinical diagnosis. So that's the one main difference between NEET and this exam.
Okay.
And if you ask me about toughness, yes, the exam is tough. But if your concepts are clear and if you are well prepared for the exam, all you need to do is just don't get scared of the exam. Go give your best shot, then you can pass. That's all.
There's so many doctors in India, they think that they are preparing for NEET PG. So, same preparation, they can pass AMC. So, what is your experience?
If you put in an effort of like 6 to 8 hours of study a day and go through all the, I mean, in Australia, it's everything on guidelines. So
Yes,
make your concept
guidelines are
based
different. Yes.
on. So, yeah, anybody who's doing NEET PG also can pass this exam if you
Okay.
put in the right effort.
Yeah, yeah, yeah. Generally, the guidelines are totally different. So most of the doctors, they are like 240 to 42 because they failed in this exam. Most of the time because they are following the same pattern, because here a lot of non-clinical questions they ask in NEET PG, but this is totally
Yes,
a clinical exam.
yes, sir. This is totally a clinical exam. There is no, I mean, every non-clinical subject is tied up with the clinical scenario. So it's not that you don't need a non-clinical subject. You need it. You need the base, but it's asked in a way how a clinical case comes. Like how we have direct questions from non-clinical subjects in NEET PG, we don't have that in games.
So Dr. Shiva, why you going for Australia, instead have you tried for any other exam in India, or maybe USMLE or PLAB? How you know about this AMC exam?
So for me, it was like I tried preparing for NEET for 1 year,
Okay.
but by the end, almost halfway through, I knew I couldn't go with this the NEET strategy. Whatever the NEET preparation was not for me, and I was more of like a clinical oriented guy. So I started looking for better options. So everyone in family and few doctors who were there, they recommended Australia as the best choice because
Okay.
of the quality of the education and everything. So that's how I came into conclusion of AMC. Then I did some research. Then I studied a lot about it. Then finally, I thought I'll give it a shot.
Okay, okay, that's good. Australia, I can say one of the best country. If I compare with UK, especially after PLAB, a lot of doctors they are not getting to secure a job in NHS, right? And similarly in US also, many doctors they pass, part one, part two, they are not going to, get in the match in US. So in that sense, and also in AMC, after part one, you are eligible to applying jobs, but you cannot apply in US, you cannot apply in any other country, like even in Canada, or you cannot apply in UK, right? So how you know about us? How's your experience with us? Any video,
So
YouTube, Instagram?
one of my cousin has actually done the B Farm course from the Academically for the same.
Okay,
She
offline
was
exam, pharmacist.
yeah.
Okay,
So she cleared a Farm D. I'm sorry, not Farm B, Farm D.
farm
So
D.
she cleared from Academically. So her mother actually suggested me, and then I contacted your representatives. Then I felt comfortable with everything, timing, classes. Then reviews were also really good. People who have tried it, and I inquired with my cousin too. So she was like very helpful. They'll be there with you throughout the journey. So I was like, I'll go for this.
Dr. Shiva, if you want to, share your anything, those who are watching us, they want to appear in this exam. So, what is your learning if you want to share about this AMC journey?
First thing is try to make at least 6 to 7 hours of study every day. I mean, don't force yourself. Don't take a lot of stress. Just have your basics clear first before going into the difficult stuff. Having a good strong base is the main thing for the exam. So half of the time the answer is just in front of you. So all you need to know is that you should have the clarity of the topic and the whatever you're having, and better not to mix study materials from here and there. Just stick on to one material,
Yes, this
stick
is
to one
the
thing, keep revising.
uh,
Yeah,
this is a very good advice.
keep
Basically,
revising.
students are mixing the material from this coaching to this that coaching, or sometimes self preparation. Please follow one wherever you are following. You can clear this exam. And academically, the
Yes,
resources A to Z we provide you. There is no need to have any other resource. We will provide you 100% resources to pass this AMC exam.
yes, sir. All the question banks from academically, all the grant tests, everything. I mean, there are enough and more questions that which is more than enough for us to pass this exam. And after giving the exam, I haven't seen a question or any topic that has come outside of the topics that has been discussed from academically. And the faculties are also really good. And in between the classes, they used to give us hints and tell us what we can expect from this and what are the deviations of the question which can go. So that was also very helpful.
Yeah, thank you so much. And I will see you basically on the session of about the job opportunities and CV, cover letter, each and everything in next week. Okay. Thank you so much, Dr. Shiva.